Thanks for joining us. Frank comes in today. Frank, you're actually a patient of Dr. Gwaine Vaughn's, right?
I believe so.
Is this our first time meeting?
Yes, it is.
So now that you've seen the better looking Dr. Vaughn, are you going to still go back to Dr. Gwaine?
Absolutely.
Okay. Okay. You have something in your ear. What happened?
Well, I wear hearing aids, and every evening I take them out to go to bed. And when I pulled my left hearing aid off, it's called a tulip that's on the end of it. The hearing aid did not come out of my ear.
Okay.
And it's detached from the hearing aid itself.
So, and the tulip is right there inside of your ear.
This is not the first time this has happened either, so I don't know.
Well, I'll tell you what, it has a silicone lip that should be able to grab pretty easily. We have the alligator forceps, which we used to have to keep these locked up in the emergency department. And then one of my favorites is just these really, just really fine tipped, you could either call them tweezers or forceps, and I can use the light from that.
Yeah, I see.
While I apprehend that. You feel it coming?
Yes, I feel something there.
So it should look something like that.
Yes, that's it.
As far as you're concerned, that's intact and complete, and
Yes.
all right. Let's look at it. Well, we're not done till we take a look at your eardrum behind where that was.
The canal?
Well, it was deep enough to make a couple of little bruises or ecchymoses or abrasions on the side of the canal, but it wasn't touching the eardrum. It was pretty close to it, so I'd guess it was fairly uncomfortable. Wow, what a beautiful shot of your eardrum. And there is one little spot, it looks like it may have been injured, and it's in the upper back part of it. It does look like it got pushed in a little too far. But if, this has happened before, is there?
Yes, it has.
I wonder if there's,
actually, in both ears, I've had them.
It probably is from getting it pushed in so far that it kind of gets stuck in the canal.
Let's see. They slide onto this little square device, but I don't know whether it latches on or if there's a groove to hold it in place. But when I put it in my ear, maybe I'm pushing too far in.
And we should probably also check with whoever services these for you, see if they have some advice for helping them keep from coming out so we don't have to do this.
It's ReSound.
ReSound? Do you get that from a local?
No, it's a mail order.
Oh, it's mail order.
Yeah.
Oh, okay. We may have to check with the company to see if they have a way of keeping them from coming off.
Yeah.
Try, though, for now, try not pushing it in quite so hard and see if that helps.
No,
Of course, we can always take it out. And if it were to happen on a weekend or something, it's not so uncomfortable that you can't wait.
we called, made an appointment. They made one right away the following day.
Good. Oh, very good.
Yeah. But anyway, well, thank you.
Yeah, just don't get water stuck behind it.
Yeah.
That would be a problem.
Yeah.
So, yeah, there was a little injury to the canal. It's just bruising. It'll heal up. All right.
And I shouldn't try to take it out myself.
Well, no, because you can't see it.
Yeah, I know.
But
all I can do is feel it, and I could maybe injure.
If you can, the thing I would say to anybody if they wanted to take this out themselves was the concern is rupturing the eardrum. So if you can confidently see it, and that's why we have the instruments we have here, and some people may have access to good magnification, that they would be able to have something small like our forceps to be confident that they're grabbing it and pulling it out without injuring the sides or the eardrum. That's the problem. So, hey, thanks for joining us, and if you haven't already subscribed, click on the subscribe button. And until next time, this is Frank. Thanks for joining us.
Thank you.
And Dr. Mark Vaughn telling you to stay in good health.